their toxicities are very different. Regorafenib mostly has hand-foot syndrome, fatigue, hypertension, and those happen in the first 2 to 3 weeks. So with the regorafenib, you have to bring patients every week to see them in clinic in the first month, and then every other week in the second month, and after that they go on cruise control. We'll find the optimal dose. The toxicities can be very tough. That's why we have to keep an eye on them, especially in patients who have very essentially a poor overall. I mean, they get to the stage, they're very tired, they're very fatigued, they're wasted, so they've gone through a lot of different treatments. So it's very important to do that. The dosage has not been optimized, so we have a study that's looking at optimizing the dose strategy, starting with 160 versus going up from 80 to 120 versus 160. That's the redose study. We'll have a readout on this study next year, mid next year, so we'll have at least a guide to the clinician about if you want to use regorafenib, how do you use it, what dose you start with, is it safe to start with 80 and then go up to 120, 160 as tolerated, or should we still stick to 160 and de-escalate? For TAS-102, the toxicities are mostly hematologic in the first month or two, and they occur fairly quick. In the first month, patients can develop febrile neutropenia. About 4% of the patients will have febrile neutropenia, which means they'll have to go to the hospital and get IV antibiotics. Neutropenia is an issue, anemia, thrombocytopenia, so bone marrow toxicity. There are some GI toxicities, but they seem to happen a little bit later. So those are the patients that mostly respond to treatment and go on treatment for prolonged periods of time, may have cumulative toxicities that we see typically with cytotoxic agents, fatigue, more diarrhea, low-grade nausea, etc. So what we need to understand a little bit more for both agents, regorafenib, we need to understand how to optimize the dose, if there's so, and then the study is being done. With TAS-102, I think we have to understand a little bit more about those patients that end up benefiting from the drug, what happens in terms of their toxicities on the longer term.